Thank you for listening to Depictions Media Radio.
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Thursday, November the 5th. We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Friday, you'll get a written report on case counts and other relevant information from Dr. Henry and myself at around 3 o'clock. And we'll be providing a briefing in person on Monday here in the Press Theatre. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much and good afternoon. Today we are reporting 425 new cases of COVID-19 in British Columbia, including 4 epidemiologically linked cases, bringing our total number of cases to 16,560 in British Columbia. And for today, starting today, I'll report on the new cases by Health Authority. 126 are in the Vancouver Coastal Health Authority, 268 people are in the Fraser Health Authority, 7 people are on Vancouver Island Health Authority, 8 people in Interior Health, and 6 in the Northern Health Authority. We have no new cases in people who normally reside outside of Canada. We now have 3,389 active cases in all health authorities in British Columbia, of whom 97 people are in hospital, 24 of whom are in critical care or ICU. We have had no new deaths in the last day, leaving our total at 273 people who have died from COVID-19 in BC. We now have 7,519 people around the province who are under active public health monitoring, and 12,806 people who have now recovered from COVID-19. Just to put in perspective, I want to, we have now, in the last 24 hours, the cases that we're reporting are from 11,020 tests that were done at labs around the province. That gives a provincial percent positive of 3.8%, again, a rise from what we have been seeing in the last few weeks. We have 2 new healthcare facility outbreaks at the Tabor home. This is the second outbreak at that facility, and Pine Grove Place in Fraser Health. And 1 outbreak has been declared over the Queen's Park Centre Care. That leaves us with 30 active outbreaks in our healthcare system, 28 in long-term care and assisted living, and 2 in acute care. We now have 1,118 people in long-term care have been affected, including 648 residents and 482 staff members. There have been no new community outbreaks, although we continue to have ongoing clusters in workplaces and other venues around the province. On the positive note, the outbreak at L'École de l'Ensable in Kelowna has now been declared over, and students and staff will be back in class tomorrow. And I just want to extend my thanks and appreciation to the family and the school officials for their assistance in working with Interior Health to manage this challenging first outbreak that we had in a school setting. And I'd like to take as well this opportunity to remind parents about the importance of keeping our schools open and making sure we keep our social contacts small. This includes birthday parties with children outside your household, sleepovers with classmates, and I know this can be difficult and challenging for children, but I ask that you look to celebrate in smaller, other, safer ways right now. And a reminder as well to continue to check health authority websites for community and school exposures. There continues, as we all know, to be strong interest in the latest data of the pandemic that we are experiencing here in British Columbia. And next week, next Thursday, we will be providing a data modeling update and continue to do so as we have in the past on a periodic basis going forward. I also want to mention that the BC CDC has set up a new COVID-19 epidemiology dashboard for those who are interested, which shows what's happening in British Columbia compared to other jurisdictions in Canada and globally. Some of that information we've presented in some of the data presentations we've done in the past, but this is a dashboard that will be updated and publicly available twice a week on Tuesdays and Fridays at the BC CDC COVID-19 data page. And it shows cases and testing information together, which gives you a sense of a more accurate picture of the state of the pandemic in each given location. So what it tells us is, for some places, there may be a very high testing rate and low numbers of cases, which shows us that many people may not be tested. For example, two countries could have the same number of cases, but a very different epidemic status if one country is testing a lot and the other isn't. So it's a way to help put what's happening to us, with us here in British Columbia, in context for people, for those who are interested. As we learn more about COVID-19 over the past number of months, we've been able to adapt our daily activities and continue many things in our communities around the province in a safe and responsible way. This is important for our overall mental, social, physical, and economic well-being, and a key goal in our COVID-19 response, to minimize the impact of this virus, both on the health system, on us individually, but on our communities. We've also adapted the guidance we have provided as our knowledge and understanding grows. And while I would like to note that while some recommendations change, the foundational layers of protection and the minimal but important province-wide orders that we have in place are our steady guideposts. There are some things that have not changed. That includes the basic measures that each of us as individuals need to take to make sure that we're doing our best to prevent transmission of this virus. And if I've said it once, I've said it many, many times. That's cleaning our hands regularly, making sure we cover our cough and not touch our face, keeping our safe distance, particularly from people we don't know if we're out in public spaces, and when we can't do that, making sure we use that extra layer of protection of wearing a mask when we're in indoor public spaces in particular. These orders that we have as well around gatherings, around situations where we know transmission has been in place, will continue and will continue to guide our way forward. But we will, as we've talked about in the last few weeks, look at our data about where events are happening in the province and supplement as needed in areas of concern. Right now, we know some things are risky in areas like Metro Vancouver, where we are seeing increased numbers of cases. This includes group activities indoors, and we have seen this. We've seen this with spin classes in gyms. We've seen this with dance classes inside. We've seen it with activities where we get together now, as the weather's getting cooler, where we congregate indoors. So if you know somebody in your social circle with COVID, that means that your risk is higher. If you live with parents or elders, or work in essential services or in healthcare, you need to refrain from these risky activities in these areas right now. As we look to the recent numbers, we're all concerned, and we're watching things closely, and we spent some time out in the Fraser Health region last week to supplement and to support the amazing work that the public health teams are doing there and doing in Vancouver Coastal and in other health authorities around the province. We did anticipate an increase as we moved indoors into the cooler weather, but it is incredibly important that we manage this increase effectively. And I am asking once again for your help to slow the spread of this virus in BC so that we can keep our schools, our businesses, and our communities open and safe. The greatest impact you can make is through those actions, small or big, that each of us takes every day. You can help by staying local, by only spending time with your household, or at most, your safe six, the same group, on a repeated basis, and by following your safety basics at work, at school, and at home. Right now, fewer faces, again, makes for safer spaces. And by staying small, we can ensure that those things that are important to our well-being can continue. If you need some encouragement, look no further than the children and teens who have so quickly adapted to these protective measures, particularly in schools. And I hear from young people all the time, and I appreciate all of the letters and the cards and the notes and the pictures that I get, where they have learned that this is something you can adapt to. You can play sports safely. You can dress up and have fun for Halloween outside in small groups or with your family at home. And young people have shown us that they are adaptable and can get through this storm. We need to use that energy and use that ability to the resilience that we see in young people to make sure that we can do this as a community as well. Let's remember that even though we think we are okay and have no symptoms at all, this virus can still be transmitted. And we need to be aware that our risk and the risk that others bring with us. In most cases, it is transmitted to those that we are closest to, whether it's in our family, whether it's a group of people that we spend time with, or whether it's in our workplace. And what we are seeing now is that this can have a very large ripple effect. It's having a ripple effect, unfortunately, in long-term care homes. And we're starting to see outbreaks again that are moving through long-term care homes. We're seeing it in group settings, particularly in the Lower Mainland, but around this province. And this is the time that we need to step back and go back to our basics. Our individual actions are incredibly important right now. Let's also remember that as the days get darker, there is lightness ahead. We know that we will get through this winter. We will get through the challenges of COVID-19. And we will do this as we have shown that we can do over the last 10 months, each of us doing our part, and by being kind and being calm and being safe. Thank you.
Thank you very much, Dr. Henry. And obviously I want to start by saying it's obviously, in spite of the very significant case numbers, a positive thing for us any day than where we report no one has passed away from COVID-19. But we know that 273 people have passed away in this pandemic. We know the impact that has on families. We know the challenges that presents in terms of mourning and celebrating the lives of the people we love. And so we think of all those people today, all of those families, all of those caregivers, and all those people currently in long-term care, especially in long-term care homes that are dealing with outbreaks, who are dealing with the difficulty and the challenge and the anxiety of those circumstances. So we think of them today, even on a day when no one passed away from COVID-19. As Dr. Henry has said, 425 cases is a significant number of cases. 97 people are hospitalized. That's 56 people in Fraser Health and 40 in Vancouver Coastal Health, 1 in Interior Health. And we have 24 people in critical care, which is -1 from yesterday. On Thursday, I report on two, and today on 3 major initiatives. One, the contact tracing recruitment initiative. The other, the second, the surgical renewal plan. Today I'm going to talk a little bit about influenza immunization in the province. But I wanted to note this about the healthcare system, that we are and will continue to be and continue to add resources to ensure we are 100% all in working not just in COVID-19, but in this time, in this moment. Never in my lifetime and time before that has the public health care system been so engaged with people in the community. I'm very proud of the people working in the public health care system, members of the Doctors of BC and the Hospital Employees Union, the BC Nurses Union, the Health Sciences Association, the BCGU, and many others. I'm very proud of the work they're doing. And consider, from Dr. Henry's report, 7,519 people under public health monitoring, 3,389 active cases, 11,020 tests today. Consider that we've hired, in addition to the contact tracing capacity we had in place, almost 600 people, and I'll be reporting on that soon with more to come. Consider that in the month of October, we set records for the number of elective scheduled surgeries we've done, indeed of surgeries done in BC during a pandemic. Consider the efforts in long-term care and the increasing capacity that we're putting in play in long-term care, the fact that we've immunized more people at this point against influenza than at any time in recent years. Consider the work of environmental health officers in assisting the community in creating safe spaces to work in the community and more. Consider that the people who are buying PPE, when we announced it on Monday, bought 49 million masks that were brought in the last week, surgical masks to assist in our efforts, and 19 million pairs of gloves. We are all in this effort. With respect to the progress report on our contact tracing recruitment initiative, in the past week, 57 positions have been filled across all health authorities. To date, there have been 580 total hires. This surpasses the initial target, which was 500 announced in August, and represents 95.3% of the increased target of 608 positions. We now, as you know, have a new target of 800 positions. In addition to those 800 positions, the Ministry has provided approval to the First Nations Health Authority to hire 76 community health representative positions to support culturally safe contact tracing efforts within First Nations communities. In addition to that, in terms of new candidates, 78 candidates, in addition to the 580, are in the offer process, and 309 candidates are in the interview process. So the contact tracing initiative is going well. I wanted to note as well that 47 contact tracers have been redeployed to Fraser Health to support their efforts there. So I want to thank everyone involved in that initiative, including the people at Health Match BC. With respect to surgeries, happy to report that this week we had a significant increase, another excellent week in terms of surgeries, and I just wanted to restate the number from last week. Last week from October 19th to the 25th, the number of surgeries increased when the final number was established. So it was a couple of days after the preliminary number, which we announced for the week, at 7,213, the second highest number of surgeries this year, and significantly higher than we generally do at this time. This week, October 26th to November 1st, in the initial count, 6,894 surgeries were completed, of which 5,726 were scheduled surgeries and 1,168 were non-scheduled surgeries. Just to put it in context, since the announcement of the surgical renewal plan and its putting in place on May 18th, 118,125 surgeries have been performed, scheduled surgeries, 34,226 unscheduled surgeries, for a total of 152,351 surgeries in that period during a pandemic, which is an extraordinary achievement for our whole healthcare system. So I wanted to give an update with respect to influenza vaccine measures, vaccine supply and doses administered. BC has ordered, as you know, 1,970,000 doses of influenza vaccine so far, and is in the process of purchasing an additional 271,600 additional doses. This will provide a total of 2,241,600 doses of influenza vaccine for British Columbians for this flu season. Just to put that in context, last year that number was 1.5 million. So to date, 1,851,130 doses of flu vaccines have been distributed by the BC CDC to regional health authorities. And just for your understanding, to date, we know that over 500,000 doses of influenza vaccine have been administered to British Columbians, which is considerably above previous years at this time. In fact, we expect the number of doses administered is quite a bit higher than 500,000, as there is a reporting lag of up to 30 days from pharmacists and physicians. This is significant, as last year pharmacists delivered over half of the immunization vaccines in BC, and we're seeing similar trends this year. And I want to thank everybody who works in pharmacy, all of our pharmacists, all of our physicians, and all of our people in public health who do an extraordinary job. I had the occasion this week, my wife Renee and I signed up online to go to the Croatian Cultural Center, where public health delivered my flu shot, and they did, of course, an extraordinary professional job, and it was good to see many people in my community there. So I just want to say in closing that obviously we said on Monday that that weekend was a significant increase in anything we had seen in the previous weekend in terms of case counts, and today's 425 is a significant increase as well. The COVID-19 tide is rising. And as I said on Monday, the context of that is that most jurisdictions, the other jurisdictions that are equivalent or dealing with significant outbreaks of COVID-19 or in their provinces are at a higher level than we are. And obviously other countries in the world, for example, countries such as France, which are about a daily case number of 64 per 100,000, or close to 10 times what our 7-day rolling average is. But I don't think people care too much what it is in Paris or what it is in Dublin or what it is in Toronto. We care about what happens here in British Columbia. I think that this is our effort, and we have to do, all of us, our individual part to turn the tide on COVID-19. I wanted to say, and this is important because Dr. Henry, a week ago Monday, put in place a public health order with respect to gatherings in homes. And I think this is an important thing to say for everyone in BC, that no matter our age, right now, when it comes to house parties and gatherings, the message is simple: don't throw them. Don't go to them. When it comes to house parties, we should all just say no to them. House parties, don't throw, don't go, say no, and stop the spread. Our BC COVID-19 response has proven time and again that as much as BC COVID-19 tries to increase its grip on our province, we have the means to stop the spread. We can fight and do that, and all of us need to work together to be 100% all in to do it together. It's who we are, it's what we do, and it's what we all need to continue to do. Je vais finir en français pour dire qu'aujourd'hui, nous en annonçons 425 nouveaux cas qui ont testé positifs pour COVID-19 pour un total de 16 560 cas en Colombie-Britannique. Il n'y a eu aucun nouveau décès lié au COVID-19 aujourd'hui. Pourtant, nous continuons à offrir nos condoléances aux familles et aux proches des 273 personnes qui ont perdu la vie durant cette pandémie. Chaque région de santé compte des patients atteints de COVID-19, bien entendu. 5223 se trouvent à Vancouver Coastal, 9707 à Fraser, 2081 sur l'île de Vancouver, 281 sur l'île de Vancouver, 821 dans l'intérieur et 438 au nord. Il y a aussi 90 cas de personnes qui vivent en dehors du Canada. Parmi l'ensemble des cas confirmés de COVID-19 en Colombie-Britannique, 97 personnes sont actuellement hospitalisées, dont 24 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder, please press *1 to enter the queue. You are limited to one question and one follow-up. Please also take your phones off mute. You will not be audible until your name is called. First question today is from Binder Sudjan, CTV.
Hi there. I just wanted to ask you, I've been hearing from some community advocates saying that they would like more culturally relevant information and guidance. Fraser Health recently has started some of that by providing guidance on how to wear a mask over certain types of head coverings, for instance. And I'm just wondering if there's been guidance provided to health authorities to get some of this information out there and to, do different types of guidance for different types of groups.
Yes, and that is something that the health authorities do on a regular basis, and really it is very localized because they know their populations best. So the initiative that you're talking about in Fraser Health, there's initiatives that Vancouver Coastal has done with different population groups, and whether it's language groups or ethnic groups and different types of celebrations. So we do some, mostly through the BC CDC and through our provincial communications, but much of that is done at a local level with the local knowledge and populations. And I know there's a number of different languages, at least 14 different ones that I'm aware of that Fraser and Vancouver Coastal regularly use across BC. But yes, it's a very good point, and we'll try and make sure that we have appropriate things coming for the initiatives that are coming up or the events that are coming up as well to support people.
I think this is a very important point. It was one of the considerations when we initially did our survey of people across BC in multiple languages and got responses from people from communities as to what they wanted to know, what they needed to know, what their assessment was of COVID-19 in the last number of months. I've done a significant number of a significant amount of outreach personally, and I know many others have, to both cultural communities but also to younger people, because I think there's two sets of issues here. One is people perhaps in diverse communities is one set of issues, and the other is people of different ages who have different approaches and get information differently. I dare say, and I hesitate to say this in response to your question, maybe less from television news and more from other sources. So that's what's required. I think what you're going to see, in addition to the other things that we've done, I think close to a dozen meetings that I've had even in the last week personally and others, that you're going to see a significant campaign to get more of that information out starting early next week as well, in order to get that out, continue to get it out broadly in many diverse communities in BC. I think it's important to do, and it's important to empower leaders in communities, and especially young people in communities, to be able to have their voice heard and to be influencers, to be part of this effort to stop the spread of COVID-19 in BC. So there's significant actions been taken, as Dr. Henry rightly says, and we're going to, I think, be increasing that activity in the days to follow, and we'll have more information for you in the coming few days.
Binder, do you have a follow-up?
I do. Just want to ask you about the Seniors Advocate report that was released this week, and also, Dr. Henry, you said last week that changes were coming to visitor restrictions for long-term care, and just wondering what changes families can expect and when you think they might happen.
Yeah, I don't have all of the answers to that. We have obviously had ongoing conversations with the Seniors Advocate, and her report is well received. We are working through making sure that we have the appropriate things in place to be able to support increased visitation for those we know who need it and their families. So it is something that we have been working on, and there are many challenges that need to be overcome. Some of them have to do with the PPE and the staffing requirements, and those are coming along, so that's the good news. The more challenging news is that we've seen this week that we have to be so careful because outbreaks can spread so rapidly in care homes, and it's not just me and my loved one that I need to be concerned about, but it's everybody in that setting. So finding that balance has been the most challenging thing that we have been faced with, knowing that this virus can be so devastating on our elders and seniors.
Next question is from Richard Zisman, Global News.
Dr. Henry, excuse me, I'm wondering if you could provide us some information about why there have been concerns raised that data is not being provided publicly around people in the healthcare system getting sick. Are you concerned that the lack of this data could expose some potential sort of shortages in our healthcare system?
Yeah, I'm not entirely sure, because I've heard some rumors about that, and I'm not entirely sure why there is this belief that that data is not shared. I've shared publicly our data on healthcare workers and what we know about it, I will say. And this was a challenge. I know I was asked whether we share it with Health Canada or with the Public Health Agency of Canada, and the answer is a qualified yes. We were sending what we call line list data as a field in our case report forms early on, but that information had been presented in a way that mischaracterized. So it was presented by StatsCan as healthcare workers who were infected in the work environment, and that is not the case. So I have presented healthcare worker data, for example, in a number of our data briefings, and made it very clear the caveats that we ask everybody if they're a healthcare worker, because it's an important thing to know whether we have to take measures to look at whether they worked whilst ill and infectious to others, and whether there were close contacts in a healthcare setting. As we know, very early on when we had limited testing capacity, our focus was on testing healthcare workers to be sure that we caught everybody. And that continues. Healthcare workers are a focus of our testing program to make sure that we can prevent large outbreaks, and we've been on and off relatively successful about that. If you look at our long-term care facility outbreaks now, almost the vast majority of them in the recent weeks have been single healthcare worker case. Unfortunately, sometimes it can spread very rapidly. So that's a long way of saying that we did stop sharing line list data with the Public Health Agency in the spring because they were sharing it in a way that didn't represent the data accurately. But we do share the aggregate data nationally, and I've presented it publicly, and the intent is to present an update next week. I can say that our percentage of healthcare workers who are infected has come down over the last few months. Not surprisingly, it's under 10%. And we also have some caveats about where people have been infected. And we know this from other studies as well. This is a community-transmitted virus now. That means that our risk is in the community with our families when we go out to places, if we're participating in celebrations, if we're going to spin classes, other things. So there are many different settings that healthcare workers become infected in, and we'll be talking more about that in some detail next week.
Do you have a follow-up, Richard?
Is there any concern around either because there are a number of healthcare workers sick or because of overall hospitalizations? I think we're at hospitalization level now that we haven't seen since the end of April, that we could once again start seeing surgeries canceled and impacts on our larger healthcare system.
Yeah, that is something, of course, we're concerned about, and we've seen that unfortunately happen in other jurisdictions. We have a plan that we had presented, and Stephen Brown, the Deputy Minister, has been working very closely with all of the health authorities so that we have a tiered approach. So right now we are well within our planned ability to respond to cases both in hospital and in long-term care, not long-term care, in ICU. So we're not in danger, but it is very much a balance. And as you say, it may not be me as a healthcare worker being sick myself and being off, but the fact that I may have exposed a number of my colleagues, either because we attended events together, which has happened, or because we are together in carpooling back and forth to work, or in a lunchroom or other settings in the healthcare setting. So not only in the patient care areas. So it can be it can be an issue, and it has strained us. As you know, we've had a couple of acute care outbreaks where numbers of healthcare workers have been exposed and have had to be home isolating because of the risk. So yes, it is finding that balance. So far, we have not had to cancel the scheduled surgeries, and we're managing to keep things up. But this is all what we're talking about. As numbers increase in our community, we start to get more spillover into long-term care, into acute care, into other settings where there are more people at risk of having severe illness. And that's why it's so important that we take these measures now to reduce our social contacts so that we can keep the healthcare system functioning, so we can keep children in schools, so we can keep our businesses open as much as possible.
Marcella Bernardo, News 1130.
Hi, Dr. Henry and Minister Dix. Hoping to ask you today about the situation involving Dr. Tam now revising guidelines to acknowledge the aerosol transmission of this virus. And have you considered how many of the record-breaking cases we're now recording could have been prevented if more people followed your directives to always wear a mask inside public spaces?
Yeah, so I don't think Dr. Tam single-handedly has revised documents, as we've talked about a number of times. There is a continuum of how people are exposed to this virus, and we get it from breathing in droplets that somebody has coughed out, and those droplets can be of various sizes, and I've talked about this many times. In some cases, in some environments, particularly enclosed settings, so we're talking about there's been some public reports around a restaurant where there was limited ventilation and the flow of air from a fan probably led to people being exposed. There's situations like a wedding where the father of the bride was close to each and every guest, gave them a hug, kissed them, and there was spread in that wedding situation that was indoors. So we know that in closed settings, and we've seen it here, of course, in some of the bars and nightclubs, and we've tried to reduce those potential for spread in those scenarios. So those are the scenarios where we can get broader spread to larger numbers of people. And those are the things that we have been taking the measures that we've put in place to try and reduce those possibilities. That's why we limit church groups to 50 with enough space between people. We know that we've had an outbreak in the interior in a church group that was probably related to singing, but it was contained because we had a limit on numbers of people that can be in that facility. So I can't tell you exactly how many are related to that necessarily. We know there's transmission in workplaces, but for the most part, what we're seeing from the investigations that public health is doing in each of those situations, what we see is that it's when people are sitting together in an enclosed space, whether that's carpooling to work together, whether that's sitting in the lunchroom together, having a break together in a small enclosed space, whether we're working together without using the precautions. We know some of the larger outbreaks we've had in places like poultry processing plants. It's large numbers of people in an indoor environment, colder weather, which we're learning again that this virus probably transmits more easily in less humid conditions and colder conditions. So those are all factors that we need to take into place. And what we've learned from the now 40 million people around the world and the outbreaks that we're seeing is that when you have those layers of protection in place, that's what stops those transmission events. And wearing a mask is a really important layer that adds an additional layer of protection.
Do you have a follow-up, Marcella?
I do. It's regarding the seniors report that came out this week. I know Binder already asked about this, but I have been talking to people who are saying that they don't understand why they have to suffer in areas like Kamloops when they want to be close to loved ones who just want to be touched by their loved ones, who the people that are dying now, many of them are not dying from COVID. They're dying from whatever conditions they already have, and their time is limited. So what can be done to try to make allowances for people outside the Fraser Health region, outside the Lower Mainland, that are desperate to try to spend more time with their loved ones?
And I hear that. I know it's very challenging. We are working with the care home operators, the people who work in the care homes, to make sure that we can put in these measures. As I said, it is the most challenging and wicked problem that we're dealing with. I don't know if you want to address that.
Obviously since June the 28th, when we started we've had consistently essential visitors throughout the pandemic. When we started having what we call regular visits on June 28th, we said we were going to also provide and support the long-term care homes with more supports and more staff, and this is an absolutely necessary precondition of a significant expansion of visits in the pandemic. I think it's pretty clear as to why. And so that effort has gone out. More than $100 million has gone out to support that effort, and we are making really an unprecedented effort when you look at the increase in staffing, which is $110 million to get to the 3.36, the $160 million to support visitation, the 7,000, of which that's part, the 7,000 new healthcare workers that we're putting in place. All of this isn't for other reasons than to improve infection control, improve the quality of life for seniors in long-term care, and of course to support visits. So it's our hope that we can do that soon. But really, as Dr. Henry has said, and I want to emphasize this, this is a week when we've had outbreaks. Our first outbreak, for example, in long-term care in the Northern Health Authority in Dawson Creek, that this can hit us everywhere. And so what we need to think about all over British Columbia is what happens when we take actions to stop the spread. It helps us expand visits in long-term care, because people who work in long-term care and people who visit their loved ones in long-term care, and it's just so that everyone understands, it's my family as well, and I feel it this very personally, that all of that is made possible when we take steps ourselves to stop the spread. So I want people, if they can, to understand the value for other people in what we can do right now to do that, and following the guidance put forward by Dr. Henry and her colleagues is so important, and it is itself an important element of our efforts to increase visits in long-term care. But you may know this is an area for both Dr. Henry and myself where we talk to people regularly, we hear from people regularly, we respond to people who talk to us about it regularly. The survey put forward by the Seniors Advocate told us in that sense what we already know, but it puts out in paper how people are feeling and the powerful impact of that we know. And so the task in this is not just to deal with COVID-19, but whether it's visits in long-term care or other issues in society, the other public health emergency of the overdose crisis, to deal with the consequences of the actions we have to take in pandemic. And that's why it's so important for all of us to recommit to stopping the spread.
Next question is from Brenna Owen, Canadian Press.
Hi there, thank you. I'm just wondering, so Fraser Health has really emerged as kind of the epicenter or a hotspot of the pandemic in BC. And I'm just wondering what other factors besides, there's more virus circulating in those communities could be fueling the increases there?
Well, the more virus circulating is certainly part of it, and I really want to emphasize, we have geographical boundaries that we use for administrative purposes, but this virus doesn't recognize those boundaries, and it really is across Metro Vancouver that we're seeing issues, and it's different in different areas of Metro Vancouver. But I will note that particularly in what we call the Fraser Health region, that is where a large proportion of essential workers live. So people who have been going to work, whether that's in healthcare, whether that's working in poultry processing or vegetable and fruit growing or trucking, we have a large proportion of people who are living in that region. And as you know, we report cases by area of residence. So people may be living in that region but going back and forth to work in different areas of the province, going back and forth to the United States for certain trucking and essential services, etc. So that is a large part of why we're seeing concentrations, but we're also seeing that there are large parties, family gatherings even. They may be smaller than 50, but there are multiple ones where we've seen transmission to multiple generations. We also know that some of the accommodations for people like temporary farm workers and others are sites where we can see more increased spread very rapidly. Some of the businesses that we've seen. We also, of course, have all of a large number of our provincial correctional facilities and federal correctional facilities are all in that region. So it's a combination of, we have a huge number of concentrated risky environments and people who work and live in that area.
Do you have a follow-up, Brenna?
Sure, just quickly, it doesn't sound like you're pondering regional restrictions like some other jurisdictions have done, but I'm just wondering about the concentration of public health resources in hotspots and whether there's more targeted messaging or measures that could be suggested.
Yeah, and we absolutely have been doing that. Our approach has always been to have the minimum provincial measures that affect those settings where we see transmission events happening. And as you know, things like we saw parties in resorts and vacation rentals, and so we put in limitations recognizing that it wasn't just interior health. And as a public health service, we are supplementing and supporting each other where these hotspots spring up. So we've had interior health in the summer. We've had issues in the north where we've had to support the public health workforce there. And again, in the lower mainland or Metro Vancouver in particular now, yes, we're making sure that we have surge resources to support in those areas now. I think relatively unscathed has been Vancouver Island, although we do have occasional cases and clusters over here as well.
Next question is from Rob Brown, Dawson Creek Mirror.
Thanks for taking my call today. Just about reducing social contact and whatnot, we've got our school divisions up here allowing third-party users of their groups, volleyball groups, rec clubs, that sort of thing. Is it something the province is looking at more on I guess, Ministry of Education basis for something more consistent across the province, or is this something you're also leaving up to kind of the more regional school districts?
So you're talking about other groups using facilities?
Yeah, like I would, I'm as an example, up here the Dawson Creek Volleyball Club or the City of Fort St. John Recreation Volleyball League in Fort St. John, for example.
So we have a group, we call it our Safe Reopening Working Group, that includes public health inspectors who do a lot of this work. It's based at the BC CDC, but we also have WorkSafe BC, and we've connected with many different groups, including sports groups. So this is an area that we've paid attention to. So in terms of using of a school outside of school hours, that would be up to the local community, and certainly that could be supported as long as it didn't interfere with children coming back and forth to the school. So those things would be made, those decisions would be made on a local basis. We also have guidance for sports and recreational groups about, making sure that we're not seeing interprovincial travel, for example, among sporting groups this year. And there's layers of, or levels of allowance for different types of activities to happen. Some sports we've recommended not be played this year, things where you can't maintain distances. We know that some are riskier than others in terms of team sports, and there's guidance for spectators, reducing numbers of spectators, how the team interacts before and after. But I think you raise a really good point. It's really important right now for us to continue to support children and the school communities, and that may mean that young people are not participating in multiple after-school groups, because that does increase our risk of coming in contact with many people, with more people who may introduce the virus into our group. So these are our tough decisions for this year, for this COVID time, where we have to say, what are the one group that we want to be involved with outside of our school cohort or our school learning group, so that we're not exposing our family and our community to increased risk. I did want to actually just go back and finish my thought from the last question, in that we have provincial level baseline that addresses situations that are same around the province, but yes, we are also looking at discussing with regions whether they need to take additional measures that are specific to issues or situations they're seeing within their region. And we see that on an occasional basis where specific business will be closed down until an inspection and a safety review can be done, and the COVID safety plan measures are put in place, and that happens at a local level. And we are absolutely, and I think I mentioned this last week, in discussions about whether we need to take an additional actions for some of the risky things that we're seeing in Metro Vancouver.
Do you have a follow-up, Rob?
Yes, I do. You mentioned exactly what I wanted to touch upon. Safe 6 and specifically young people and reducing exposures. I'm just going to run you through an example of a student's day, and just want to get your reaction. If a student wakes up, does their morning routine, goes to daycare, then takes the bus to school, does everything that goes on at a school on a regular elementary school day, then takes the bus to daycare, then is taken to, say, a karate class or a gymnastics then a gymnastic class, and then home. Is that an example of keeping your safe 6, or is that more of an example of somebody's habits and a daily schedule that might be something that should be reduced for fear of spread?
Again, none of these things are black and white. So I would say it depends. It depends on where I live in the province. It depends on how many people in my karate class are my siblings. It depends on if I live in a large family with the elders or I have regular contact with seniors in my life. So it may be perfectly okay for some children. It may be that my preschool and after-school care and the bus to get back and forth are all with the same group that are part of my cohort at school or my learning group at school. So there are many different variables, but I do say in general, this is a year where we need to consider not expanding our bubbles and doing those things that we might usually do by having a number of different groups where we interact in situations like a gymnastics class, like indoor settings where we may have the probability of transmission of this virus or bringing it home and spreading it to others. So it is partly situational dependent, but this year we need to reduce our social interactions and those potentially optional interactions. And I say that potentially because we all know how valuable it is for physical exercise to have music and arts in our lives and how that enriches our lives and keeps us healthy in other ways. So we need to make choices this year about which of those are important for us right now and recognize that this is not forever. And, I hear so much from young people about they get that. And they can get through this, and they can adapt to it. And we all need to take that attitude as well. This will build resilience and will help us appreciate next year when we can expand and we can get together again in ways that we want to.
We have time for one more question. For everyone listening today, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca for medical guidance on protecting families and communities, and for access to provincial guidance on COVID-19, visit bccdc.ca, and for information about the province's pandemic supports, visit gov.bc.ca/COVID-19. Last question is from Tanya Fletcher, CBC.
Hi, Dr. Henry. As I'm sure you know by now, people love specifics, and I think hearing anecdotes are helpful in getting the message across. So I just want to go back to an example you briefly touched on earlier about, I think it was the father of the bride. Just wondering, when was that wedding and how many people were affected by the virus as a result?
Yeah, so that wasn't in BC. That's a report that's been in the media. That was not in the media, in the literature. It's one of the examples that we've come to understand. So this virus is one that we now call. It's not like influenza. With influenza, the incubation period is very short. People get sick within 1 to 3 days of being exposed, and we can be infectious to others in that period of time. So it moves through populations really quickly, and it affects everybody. With this virus, most people, the incubation period is longer. It can be up to 2 weeks. Most people get sick about day 5, day 7 after they've been exposed. So we have a period of time where we can take people out of harm's way, essentially, and monitor them. We don't have any drugs right now or medications that help us stop you from getting sick, but we can remove you from those situations where you might be infecting others. But we've also learned that some people can transmit this virus before they realize they're sick. So that's where we get into that challenging period where we want to make sure we're not in group situations with large numbers of people indoors, crowded, close to each other, sharing food and drinks, talking, kissing loudly, kissing, those sorts of things where we know we can spread this virus very quickly. So this was a wedding that took place in the U.S. There was over 200 people who attended, and I believe there was something like 100 and some who became ill, including some people who died. And the thought was, well, if it hadn't been the father of the bride, if it had just been a guest, maybe it wouldn't have spread that much. But the challenge we have is those opportunities for us unknowingly to bring it into a situation where we're in close contact with people and can spread it. Our example I used last week was the tragedy of a woman in her 80s who went to a very small party in a home in Metro Vancouver where there were under 10 people there, and 3/4 of them became ill, and she died, unfortunately. So we've seen lots of those little clusters, or what we call super spreader events, where the situation is what allows it to be spread to so many people. That's why I get so fussed about keeping our numbers small. We had a church outbreak in the interior where there were less than 50 people at the service. Somebody, unfortunately, was unknowingly shedding the virus. They had a lot of singing, and some people at that church service became ill, even though they were ostensibly trying to keep their distance and making sure that they weren't having tea afterwards and things like that. But it can happen. So that's why it's so important for all of us to reduce those situations. We've heard about the spin class in Ontario where 60-some people were infected. We know there's been spin classes here in BC where we've had 20 or 30 people being infected. Right now, spin classes in Metro Vancouver are dangerous. We should not be doing those things. We need to find other ways, I should say indoor spin classes. The outdoor ones, we haven't seen transmission. But, those are the types of situations where we need to pay attention to how much virus is in the community and what types of risks we're potentially exposing ourselves to. And, I have to say I've not been to a spin class myself, but we're in bikes, people are sweating, I have seen them. And, there's usually loud music and you're in an indoor space and people are breathing heavily. The instructor is shouting instructions. Right now, in Metro Vancouver, that is dangerous. We should not be doing that. Let's find other ways of keeping our gyms open, of having exercise that people need for their health and well-being.
Do you have a follow-up, Tanya?
Yes, please. So given that, you just said how dangerous they are, why aren't those places, perhaps going to be shut down? And going back to what you mentioned about the church, and you mentioned a few minutes ago about family gatherings, I think it was when talking about the Fraser Valley at some events and weddings where people respected the limit of 50 people or fewer. But if the spread is still happening, is there a consideration, and when would that be, to limit that size further? And going back to the gyms, and what would be the next step to shut those places down as we head into the cooler weather? And an answer in French, please. Thank you.
So, the overall guidance that we have addresses all of those situations. And what we've said is, we can't expect there to be 0 cases because we know this virus is spreading. What we need to do, and what we all need to work together to do, is minimize the number of people that we're spreading it to, and make sure that we're doing everything we can to protect those people who we know are more likely to end up in hospital or to die from this virus. So much of it depends on our own personal situation and the elders and seniors in particular in our lives. But yes, local public health did take action in each of those situations I was talking about to address the individual situations, the individual business, the individual gym, and those are the types of things that we are putting out here so people understand. You need to understand the risks in the situations you're going into. There are many other situations, and local public health is addressing each of those under the provincial framework that we have.
Yeah, I was going to say, Dr. Henry, in some years I've done hundreds of spin classes, but this year, 0. No spinning this year. And I think there's good reason for that. And I think with respect to the question of gatherings, the maximum in a private residence is 6 guests. And if you're in Metro Vancouver, you should seriously consider whether 6 is appropriate. And that's because it's different in people's homes. And so when we talk about weddings and other gatherings, frequently there are parties associated with that both before and after, as we know. And it's in those events and multiple of those events that we've seen transmission in recent weeks. So, the message is the same. No parties, don't throw them. En français, je dirais qu'il est essentiel actuellement surtout dans la région de Vancouver, mais partout dans la province, parce que à l'intérieur, il y a beaucoup plus de cas actifs qu'avant aussi. Mais il est essentiel que des gens suivent des conseils de la santé publique, c'est-à-dire que chez eux, un maximum de 6 personnes. Et si on vit de la région de Vancouver, notre préférence serait 0, n'est-ce pas? Donc, pas de soirée. Et c'est difficile parce qu'on vit actuellement une période où il y a beaucoup de fêtes, des fêtes religieuses et d'autres fêtes. Mais il est essentiel cette année, pour actuellement, pour aujourd'hui et demain et les mois qui suivent, que des gens n'invitent pas beaucoup de monde chez eux, un maximum de 6, et qu'ailleurs, dans les endroits où il y a un plan pour combattre le COVID-19 dans un restaurant ou quoi que ce soit, de suivre des conseils de la santé publique aussi. Donc, c'est absolument essentiel en ce moment de suivre ces conseils, surtout dans la région de Vancouver, mais partout dans la province. On vit dans une pandémie internationale. Et dans d'autres pays, on voit les effets. Dans d'autres provinces, on a une situation beaucoup plus sévère que la nôtre, mais quand même, ici en Colombie-Britannique, 425 cas, c'est trop. Et il faut prendre l'action. La santé publique est en train et a pris l'action depuis des mois, et ça va continuer, mais tout le monde doit les suivre. Merci beaucoup. Thank you very much. We'll see you on Monday.
Thank you for joining us.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.